we're here. We're in the ambulance bay at Mahaska Health, and behind you is one of the, I'd say, an older ambulance. Can you tell us a little bit about that?
Sure. It's a 2017 Ford F450 diesel. We received this in 2018. It was our newest ambulance up until we recently came home with the 2022 that we just purchased.
All right, and we're going to go take a tour of that here in a moment. That we just wanted to make sure everybody knew that that wasn't that ambulance behind you. As the new ambulance looks to be put into service within the next week or two.
Sure. Yeah, it's going to next week. We're going to have the new logo put on that. We're putting the finishing touches on it. It's pretty much stocked and ready to go. If we need to, in an emergency, we need a third out rig. In the meantime, we sure can use it, but it'll officially be in service next week.
All right, and I know that you guys were pretty excited. This came in the same day as the fire department got their new apparatus as well. It took a little while to come in.
It did. You know, with the way that our service industry is right now, with the supply chain difficulties, this one took. Typically, they take 6 to 9 months. This one took 16 months. However, when we went to pick this up, we feel very fortunate because right now the lead time on these is 2 to 3 years. So it's across the board, across the nation, with all of these supply chain issues. So we're fortunate to get it in the time frame that we did.
Well, with that being said, are you looking at ordering the next one already?
We already have the quotes for them, and I'll be placing an order here shortly, within the next day or so. And you know, we're going to change it up a little bit. We're looking at a Ram this time with a Cummins, and those are in such high demand that it's difficult to even place an order right now. However, you know, we do it early enough, we should fall right back into our schedule of where we want to order a new ambulance every 3 years. So,
well, I know one of them's four-wheel drive. Is this new one four-wheel drive as well?
Correct. So the 2017 behind me is four-wheel drive, liquid springs on the rear, air ride on the front, and our new one is also a four-wheel drive. We upgraded it a bit on this, made a couple concessions. We put liquid springs on the front also, which really changes the dynamic, that smooth ride. It's great for the patients, especially when you're going through town, driving down a highway that might be you know, not as smooth as most. It really gives that comfort to the patient. With the another upgrade we did was the load system, so an automatic load system. So that really is a safety feature for not only the paramedics to you know, put that cot right up to that load system, press a button, and that lifts everything up, and you just slide that easily in. It's also a safety feature for the patient. You know, there's less opportunity for them to you know, tilt or tip or anything. So it's a great system to have. And we actually have plans to upgrade our 2017 with that system at some point also.
Well, let's talk about it. You've got some new equipment. Let's talk about how you've seen ambulance technology evolve over your time in the industry.
So I've been in EMS for 13 years now. Mm-hmm. And back when I started, we were really starting to get into those truck chassis. More an upgrade from the van chassis. So you've seen that a lot more common now. They last a lot longer. You get the diesels, you take care of them, you maintain them, and there's a lot of services that are now, especially with the supply chain difficulties, they're remounting boxes. They'll do a refurbished box and continue to use that chassis. So really, that's the plan moving forward. We want to keep these chassis, do a remount on them, and really get everything we can out of them. So,
how many miles do you look at for those refurbishment sort of things?
So we haven't done that. This will be our first one. So we're going to get everything we can out of it. A good example, our ambulance that we just replaced, it was a gas engine. We had just under 250,000 miles on that. You know, with these diesels, we'll be able to get even more than that. So really, it's how well you maintain them and how well you take care of them. I think typically if you refurbish, you do one box of refurbish per ambulance is about what I understand.
Well, and as a recent patient of Mahaska Health, mm-hmm. The paramedics that showed up at my house were also in the ER with me. So you get that continuous service.
So yes, continuity of care is a big point with the hospital-based service. Our paramedics, when they're not out on calls, they're working right here in the emergency room, right alongside the nurses and the physicians. They can help out with that care. They know what the problem is out in the field with the patient, what the diagnosis is, what kind of care was needed, what the chief complaint is. They can come in here and help continue with that care, and work alongside the nurses to improve that patient's outcome. And then if that patient needs to go to a tertiary facility, they can continue with that care right on all the way up to another facility if needed. Mm-hmm. So that continuity of care really helps with that outcome.
All right, and I know that this is all takes a whole team, and I know some of the political leaders locally and all that had some part in all of this that was going on.
Yes, we're very, very thankful to the county supervisors that provided the funds for this new ambulance. It was a great effort that we worked together on to provide the latest and greatest ambulance that we have now in our hands for the community. And it's an important part of running an ambulance service. You've got to have that equipment that is up to date, and it works well and it's well maintained. So we're very appreciative of their help with that.
All right, and the old ambulance, I think it has going to continue to serve our community.
Absolutely. So the ambulance that we're replacing with, we've donated that to the CERT team. And they're going to utilize that for emergencies, fire scenes, to help with the firefighters, rehab, with drinks and food, warmth, and whatever they might need to continue fighting those fires in extreme conditions. So.
Okay.
This is the latest and greatest. We've got all of the same layout that we've had before. Our linens and equipment up here. This is our cardiac monitor. These are actually new. We upgraded in December. We got these in service, and so they've got a good 8 or 9 years ahead of them. The Zoll monitors, they're top of the line monitors. We've got our new drawers. Some changes that they made, the way that we access the drawers and the cupboards, that they found that works a little better, a little safer. One of the other things that on the outside of this ambulance, on the side, we've got our compartment that holds all of our backboards. We can also access that now from inside if we want to, our cervical collars and head blocks, that type of thing we can put up in there, which is a nice feature. It's all the little things that add up that really make it a top of the line unit. The load system now, I talked about, that's, it's right here. This will just slide straight on out, press a button and the legs drop down and you just disconnect it and wheel it off. When you're ready to load it back up with the patient on there, you snap it right into that load system, and that holds that in the air while you raise the wheels and scoot it on in effortlessly. So it's a very nice upgrade.
Okay. So
yeah, you can see we're still in a state of putting it in service, IV poles and pumps and equipment, but we're almost there.
All right. Well, very good. Thank you for a quick tour, and